The newly formed Cook County Health and Hospital System hosted a town hall meeting at the Chicago Urban League on October 28, 2009, to present a draft of their strategic plan for the future of health care in the county. At the meeting, hundreds of residents, including nurses, doctors, community members, representatives from local labor unions, and patients from the 3 county public hospitals, came out to tell the CEO, William Foley, and Warren Bates, the chairman of the independent board, what they wanted to see in terms of their health care. In addition, the health and hospital system recently announced the elimination of almost 700 vacant and 335 field nurses and other frontline workers positioned at Provident, John H. Stroger Jr., and Oak Forest hospitals. And they also plan to cut all inpatient services at Oak Forest and Provident Hospital, which services primarily low-income people. These moves are not sitting right with many people who showed their discontentment at the meeting.
Any partnership with anyone, and you know in the Bible it speaks of a partner being equally yoked. Yes. Now, their mission is for money. Yes. They want some county money. Yes. The mission of this hospital system is comprehensive health care with dignity and respect, no matter how much money you have. No, and don't play games with us. We both are part of the town, and we know what to do. All right? All of you all, Mr. Foley and the rest of you, and his staff, they get paid. These politicians are getting paid. We are paying them, and they got to do what we think. And our strategic plan is to let us fix it. Thank you.
Provident Hospital has been a stable institution in our community.
All right.
It's a staple. It's a historic landmark.
Yes, it is.
Given Daniel Hale Williams
Yes.
with the first open heart surgery.
Okay.
And our kids talk about Provident Hospital.
Okay.
So we don't need, as he said, Provident Hospital to close.
All right.
We need it to stay open. This is Angela. Angela was a friend, a neighbor, and my goddaughter. She had her 21st birthday, August 30th. We buried her on September 19th, 2009. She had a condition known as renal medullary carcinoma, an aggressive form of cancer, which will take you down. And I had to sit and watch that slow, painful, agonizing trek toward her demise. I see the same thing happening here. You hate to lose someone you love or something you love.
Right. Yes.
And that's Provident Hospital.
Yes.
But we watch as we begin this slow, painful, agonizing demise to the close of this hospital. If you remove inpatient care, the next step be the emergency room.
That's right.
If there's no emergency room, no hospital, it's going to close. There will be nowhere for them, even if you don't have nowhere for them to sit, to go upstairs. So if someone was seriously ill, someone was shot, someone fell out on the street, they would bypass Provident and have to take them all the way to the west side. The Stroger Hospital. Do you realize what valuable time is being lost? Because it's going to take at least 20 on a good traffic day. 20 minutes, 30 minutes to get to Stroger Hospital on the west side. Yes, I understand in some emergencies they would take them to the nearest hospital. which would be Mercy or University of Chicago. But you know, we all know, some hospitals don't take you if you don't have the right kind of card. So that would take at least 8 to 10 minutes to even get to those, and assuming they would take you when you get there. So when you close inpatient care, we want you to take a serious, I mean serious look at that. Do not close inpatient care. Right. Do not close Providence Hospital, because it's a place that we need it, we love it, and we want it to stay in our community. Yes. All right. And as I looked at this obituary, I said to myself, I don't want to go through that again. We should not have to go through that. To sit back and watch hopelessly, but hopefully that something good would happen. We're not going to sit back and watch as they close Providence Hospital. We're not going to sit back and watch that slow, agonizing, painful process of closing Providence Hospital. We want Providence Hospital to stay open, keep it open, keep it open, keep it open.
My dad had glaucoma. The eye blood pressure went up to 170. He's in great pain. So we went to the Cook County Hospital immediately and had the surgery done. The reason we're so grateful because we know he had glaucoma. And we went to the University of Illinois Optometry Center, and they recommended the surgery, but they refused to perform. So we were referred by Dr. Sandy Gibson at the Near South Clinic to go to Cook County Hospital to get the care. So I am here to represent the Chinese community, which is a small community in this area. Is located in Cermak, Chinatown, and majority of the residents do not speak English. And we depend on the Near South Clinic, which is located on the 35th Street, which is a bus drive, and then we heard maybe it's a rumor, they're going to close that clinic or they're going to modify it. I'm here to try to beg you, please, do not close that clinic. If you need to improve that facility, if you don't have money, please do it in a phase. We honestly want that clinic open. Because there is no way the Chinese community, all the Hispanic community located in the Pelson area, they all depend on this clinic. Lots of patients every single day show up in the clinic. And they don't speak English. They have people like me. Their daughters or their sons take them, drive them to them. I have to take a day off to accompany my parents, which I will. And if you close that clinic, you move to 87th Street, it takes me an hour to drive there. And it's just, and some people who do not have their daughters or son here, they don't have a car, they can't have access. One of the strategic plans you just mentioned is improve the accessibility. And I think that clinic, well, I'm sure a lot of other clinics, like the Near South, need to stay open. Thank you.
Be advised. We need an expansion of the public health system, not cutbacks. I repeat, we need an expansion of the public health system and not cutbacks. We need more public health clinics, not less. I repeat.
Slowing down the process. We're here tonight to talk about the strategic plan. That's what we're slowing down. We are not rescinding the staffing reduction.
Okay.
The next.
Doctors and nurses, it's like, oh, these layoffs really didn't affect direct care. It was just some people in janitorial and food service. I am so sick of that. Sick. Everybody needs respect for the work that they do at Cook County Hospital. Our employees that I work with are so multi-talented. They, first of all, came from janitorial. They know our CNAs. They know how to cut hair, because our hospital's already been devastated, and it really sends such a bad tone. So please, we are all important to the hospital.